Hey everybody, whoever's going to watch this, my name is Alex Stampeck. I'm a licensed acupuncturist and doctor of Oriental medicine. Today I just want to discuss a few protocols that really work well for me in my practice for shoulder pain and sciatic pain. Okay, so the first thing we're going to discuss is shoulder pain. The most obvious treatment will be to analyze the shoulder, and as we were looking at the motor points before, the infraspinatus generally is the most tender on a lot of rotator cuff issues. So what I like to do is kind of find the spine of the scapula, do a little palpating, and your patient will let you know when you definitely find that spot. So after a little bit of palpation in there, she'll feel it, it'll be nice and tender. Yep. So once you've kind of identified a good spot, give it a good little massage, a little bit of a rub to kind of bring it out a little bit. So she's definitely feeling it. So after you've located it, you'll get your needle and we will give it a nice insertion. It's nice to kind of hold the muscle kind of open a little bit and really kind of get on that motor point. Okay, so before we had located trigger point around here, definitely elicited pain in the patient, so lets you know that you're on the right track. So again, after minor palpation, you find that it's nice and tender in here. So again, I found the spot, so just gonna kind of my needle up in there, give it a little distraction, and just kind of get it in there without touching the shaft. Just gonna kind of get on there, and she will let us know when she feels a little bit. So totally there. I felt the needle jump just a little bit, absolutely on that motor point, and it's gonna really take care of a lot of rotator cuff and pain referring to the other side. Our next protocol for shoulder pain is the map of the foot. So in a reflexology chart, this area represents shoulder extremely well. If this toe represents kind of the head and the spine down here, these will represent the arms and these represent the legs. So this is the same side shoulder and arm. So again, this area corresponds extremely well to the shoulder. Oftentimes, just in through here, just a little bit of massage, just a little bit of palpation will elicit a lot of kind of pain and referral, even sometimes up to the shoulder. So just a light kind of massage in here. I don't recommend needling the foot. It's very, very sensitive. Most people generally can't take it, but good manipulation in this area and just kind of palpating, you might find some good crunchy areas and whatnot, and just sometimes giving it a hold or using a massage tool and just giving it a little bit of work after you've done your local needling can really give a good response. Our protocol for shoulder pain will be the lower leg here. So the most famous acupuncture point that we know would be stomach 38, halfway between our 2 points. If this is 16 soon, we find the 8 soon mark and find the tibia. And a lot of times it'll be nice and tender right into this area, maybe kind of extending out a little bit. A little palpation will yield the tenderness. So stomach 38, very good point for it. Also known as a master tongue point, 77.09. It's called Se Hua Zhong. Se meaning four, Hua meaning flower, and Zhong from Zhongjian meaning middle. So very strong point for same-sided shoulder pain. Roughly, soon out where we would find stomach 40 is another master tongue point, 77.14. This one's Se Hua Wei. Se again meaning four, Hua meaning flower, and Wei from the word Wei Mian, which means the outer side. So a lot of strong points in here refers very strongly up to the shoulder. Lastly, we have roughly again spleen 8 area up in through here. Again, palpation will yield tenderness. Master tongue point 77.18 called Shen Guan, which would be the kidney gate. Again, a very strong referral pattern up to the shoulder. Okay, so our reflexology map for sciatic pain. The heel, the calcaneus, represents the base of the spine and the hip extremely well. The sciatic area usually runs kind of across the middle here, and the back kind of refers to hip. I also find that inside the heel, just in here or just outside, refers extremely well up the body and maps it extremely closely. So any manipulation with your hand, you can find some tender spots. Again, this inside area kind of represents the low back and the kidney area. So oftentimes low back pain referring to the hip can kind of be found in this area here. Using a massage tool or a trigger point device, sometimes just kind of lightly kneading and finding a tender area really brings relief up there. So you can kind of grind in through calcaneus, up in through here, removing any obstructions, any crunchies that you kind of find, and it brings that relief up to the hip. So our distal treatment pattern for sciatica will be kind of hand projection. We're going to use some master tongue points for this, very effective for sciatica, and oftentimes in practice I see that opposite side hand treats the opposite side sciatica. So the points that we're going to use are going to be Da Bai and Ling Gu, both on the large intestine channel. So a lot of times I find that needling Da Bai kind of as if you were needling over to the small intestine channel, kind of right by the metacarpal bone here. Very, very effective, very tender a lot of the time. So it is located by kind of drawing the thumb together a little bit, and right kind of where the crease comes in is a very tender spot. So palpation again, kind of finding it, maybe giving it a swab, and then inserting your needle. Very strong. Ling Gu, meaning spirit bone, is found further up. It's kind of found at the first and second metacarpal kind of root up here. Very close to Li4, but more hugging the bone a little bit over here. So palpation again will kind of yield tenderness. Very strong point, as we know. Okay, and lastly over here, if we look at a projection here, if this is going to represent the spine, which it does actually very well, a lot of times I find that the tenderness comes at the base of the spinal projection here. Palpation again will yield nice and tenderness down in through here, usually kind of by the base right in through here. So just some alternative therapies, just some things to think about using projections of the body to treat distal areas. Very effective. Again, you can do local area, like motor points, just to kind of free up the area and loosen things up, but using the distal areas to kind of draw and kind of open up energy through those areas. Very effective. You'll find that your patients will have a lot of relief with just a few needles. So again, using the reflexology map, very effective, especially when you've done some distal points in the upper body and you need something else to kind of bide your time and do. Work on the foot, kind of find some areas, and you'll be surprised at how much relief that can bring your patients.